So that particular trial, what we were looking at is a combination of a MEK inhibitor called binimetinib, which is an oral MEK inhibitor, in combination with pembrolizumab in patients with between 1 to 3 lines of therapy in metastatic triple-negative breast cancer. So what we found is that the combination of the binimetinib and pembrolizumab is safe, but at the lower dose of 30 milligram twice daily rather than 45 milligram twice daily. There were some patients that had dose-limiting toxicity with mainly the liver function test abnormality. So the dose was decreased for our phase 2 portion. So what we found was that the overall objective response rate is about 33%. On the other hand, when you take out patients that had liver metastases, the objective response rate was 55%, because there are some data show that patients with liver metastases, especially with the immunotherapy, those patients may not respond well to immunotherapy because the liver metastatic lesion can sequester CD8 T cells that are supposed to help with the response. And we also shown that if we do some biomarker that looking at PD-L1 expression in the circulating tumor cells, that actually predict the response in our trial better than the PD-L1 expression in the tumor. So that's the main finding of the trial.